Hello, this is part one of a two-video series covering hemodynamic disorders. So we are going to look at an updated mind map of what are the major events that can go wrong with blood vessels and in terms of hemodynamic disorders. So first of all, I have a very rough drawing of a blood vessel. The red dots represent red blood cells, the blue dots proteins, and then of course we have plasma. And in terms of what can go wrong with blood vessels, there are four things to look at, four main pathologies that can go wrong, and we're going to look at them one by one. So first of all, there can be an abnormality with flow. And secondly, there can be leakage. And this leakage I have divided into two main parts because it can be just the fluid or it can actually be whole blood. And then thirdly, there can be obstruction or blockage of the blood flow within the vessel. And fourthly, I have just written this up as a bulge, and what I mean is abnormal dilatation of the blood vessel. So in this video, we're going to focus on flow as well as leakage. And in part two, we are going to focus primarily on blockage and just end off with a few brief words on abnormal dilatation of the blood vessel. Let's start by looking at flow. And what I'll focus on is a situation in which there is too much blood within the blood vessels. And this can be divided into two main etiologies. The first of which is an active process, and the second is a passive process. In the active process, we actually have arterial vasodilation, and this brings more blood into the blood vessels. So there's more blood entering the blood vessels, and this is known as hyperemia. Examples of causes would be acute inflammation, exercise, as well as blushing. In the passive process, this is due to venous outflow obstruction. And this passive process is called congestion. And two very important causes include congestive heart failure and also, of course, venous occlusion. So this is just a very quick summary of abnormalities in terms of too much blood in blood vessels. Now we are going to focus on leak. And in this first part, this is when there is excess extravascular accumulation of fluid, not whole blood, but just the fluid components of blood. And this essentially is the definition of edema, which means when there is too much fluid that exits from blood vessels and enters the interstitial space. And there are two settings in which edema can occur, one of which is known as an exudate, and the other is in the setting of a transudate. So there are some key differences between exudates and transudates. First of all, when the fluid is analyzed, the protein levels and specific gravity is actually higher in exudates, and it is lower in transudates. In terms of the cause, for exudates, this is usually due to increased vascular permeability. So the vessels become leaky, and again, we can see this in an active process, very similar to hyperemia. So we do see this in acute inflammation. Now, moving on to transudates, this can occur in two main settings. First of all, when there is increased hydrostatic pressure within the blood vessels. And this can be seen in the setting again of congestive heart failure. So again, this is related to congestion and also, of course, venous occlusion. The other main setting for transudation to occur is when there is decreased plasma oncotic pressure. So the main contributor to oncotic pressure is really the plasma proteins, and therefore conditions that cause low plasma protein levels can cause transudation. So for example, in liver or kidney disease. And the reason why plasma proteins are low here is because the liver actually produces albumin, and proteins can be lost in kidney disease in the urine. Now let's move on to the second type of leakage from blood vessels. And this occurs when there is whole blood or the entire contents of blood vessels actually move out into the extravascular space. And this is usually when there is a breakage in the vessel wall. So when whole blood enters the extravascular space, it exits from the blood vessel. Of course, this is known as hemorrhage. And hemorrhage in turn can be seen in two main contexts, one of which is traumatic, and this is quite easy to understand. For example, if there is an injury where one cuts himself, or it can be spontaneous, and this is usually in the setting of an abnormal blood vessel, say arteriovenous malformations where the vessel wall is weaker and structurally abnormal. And again, if we think about hemorrhage, the timeline is also important. This can be acute or it can be chronic. In the setting of acute hemorrhage, especially in very severe hemorrhage, say a large blood vessel has been injured, then this can lead to a state of shock. Let's say a few words on shock. And shock is defined as a state of inadequate tissue perfusion, and this leads to tissue hypoxia. The main settings in which this occurs is when there is failure of the pump, so there is inadequate cardiac output, or when there is inadequate effective circulating blood volume. So this can be seen in the context of massive hemorrhage, for example. And there are some well-known causes of shock or types of shock. We have hemorrhagic shock, where there is loss of a large amount of blood. And you can see here this is related to the cause of loss of effective circulating blood volume. We also have cardiogenic shock, and this is where there is pump failure, and this relates to the cause of inadequate cardiac output. Another type of shock is distributive shock, and this usually occurs when there is generalized vasodilation, and one example would be in septic shock. So just a quick summary of what we have covered here. We have looked at some of the main events that can occur in blood vessels and give rise to hemodynamic disorders. First of all, abnormal flow, and we looked at too much blood in blood vessels, which can be an active process, hyperemia, or a passive process, congestion. We have looked at two types of leakage of vessel contents into the extravascular space, where there is just leakage of fluid and some proteins, occasional cells. This is known as edema, and the two main types are exudates and transudates, and they have different underlying causes. And we have discussed leakage of whole blood into the extravascular space. This is known as hemorrhage, which can be traumatic or spontaneous, and acute or chronic. And in acute massive hemorrhage, this can lead to shock, which is a state of inadequate perfusion, giving rise to tissue hypoxia. This can, of course, eventually lead to death. And the main types of shock include hemorrhagic shock, cardiogenic shock, and distributive shock. In the second part, we will focus primarily on blockage or obstruction of blood vessels. You can find this mind map as well as many other mind maps on basic pathological processes as well as systemic pathology in our free online pathology resource, Pathweb. Registration is completely free and the registration link is in the video description. Thank you.